Half of all people who die from heart attacks had completely normal cholesterol the week before. Ever wonder why seemingly healthy people suddenly drop dead from heart attacks that nobody saw coming? Marathon runners, gym rats, people who actually meal prep on Sundays. Today, I'll explain why being healthy doesn't automatically mean your heart is actually healthy, like you're 5 years old. By the end, you'll understand the hidden warning signs your annual physical completely misses, and the simple test that can catch a heart attack brewing 10 years before it happens. Here's the uncomfortable truth that should terrify you. The number one thing your doctor checks every year is normal in half the people whose hearts decide to stage a surprise rebellion. Your annual physical is checking risk factors: cholesterol, blood pressure, maybe blood sugar if your doctor is feeling thorough. But risk factors aren't the same as actual damage. They're predictions, just like weather forecasts that sometimes get it wrong. Sometimes the forecast says sunny, while a tornado is already forming in your backyard. So what's actually happening inside your body right now? Your arteries are like pipes under your sink. You can't see inside them from the outside. But inside, gunk is building up, with calcium deposits and plaque. All the stuff your body's been dealing with from stress, inflammation, genetics, and that decade you spent thinking energy drinks were a food group. Eventually, that buildup blocks the flow. Or worse, a chunk breaks off and causes a complete blockage. That's a heart attack. And the really messed up part? You won't feel any of this happening until it's go time. No warning light on your dashboard. Just a normal Tuesday that suddenly becomes the worst day of your life. Now, here's the really interesting part you need to know. There's a test that can actually see this buildup happening right now, today, even if you feel perfectly fine. It's called a coronary calcium score, and it's basically a CT scan that measures how much calcium has accumulated in your arteries. Think of it as a radar system that shows you the storm that's already forming, instead of just checking if conditions might create a storm someday. The test takes about 15 minutes with no needles, no contrast dye, and no fasting. You lie down and hold your breath for a few seconds. Then boom, the machine can see calcified plaque that's been quietly stacking up. Your score tells you how much damage is already there. A score of 0 means you've got clean pipes. 1 to 99 means some buildup but manageable. A score over 100 means it's time for action. Time to have a serious conversation with your cardiologist about what's happening and what to do about it. Here's a real example that proves why this matters. Picture a 50-year-old guy who's a fit cyclist. He exercises regularly and eats well, doing everything right. Goes in for a CT angiogram, that's the more detailed version of the calcium score test, and discovers he has 50% blockage in what doctors cheerfully call the widowmaker artery. He had no symptoms at all. No chest pain, no shortness of breath, nothing. His only warning sign was slightly elevated LDL cholesterol, which half the country has. But because he got screened, they caught it early. He could treat it before it became a full-blown heart attack. That simple test probably saved his life. And here's the kicker. It cost less than your monthly Netflix and Spotify subscriptions combined. Now I know what you're thinking. Great, another thing to be anxious about. Another test, another bill. And look, I get it. Health anxiety is real. But here's the thing. This isn't about creating fear. It's about closing the gap between what you assume is fine and what's actually happening. You're not a hypochondriac for wanting data. You're being smart. It's like checking your bank account before a big purchase instead of just hoping there's enough money. One approach is based on hope. The other is based on information. And when it comes to your heart, hope is a terrible strategy. So who should get this test? If you're over 40 with any family history of heart disease, like a parent or sibling who had a heart attack or needed stents, you should ask your doctor about a coronary calcium score. If you're over 50, even without family history, same deal. Get the test. And if your doctor brushes you off with, "You're fine, your cholesterol is normal," push back. Politely, but firmly. Say you want the data. You want to know what's actually happening inside your arteries, not just whether your numbers fit into a neat little range on a chart. You're allowed to advocate for yourself. Now let's talk about the exercise confusion, because this trips everyone up. Some people hear this information and think, "Oh, great, exercise is bad for my heart. I should just stay on the couch." No. Absolutely not. Exercise is still one of the best things you can do for your cardiovascular system. But there's a right way and a wrong way to do it, especially if you're older or have risk factors you don't know about. About 80% of your cardio should be what's called Zone 2 training. That's a conversational pace. You could talk in full sentences without gasping for air. Your heart rate stays around 180 minus your age. So if you're 40, that's about 140 beats per minute. The other 20% can be higher intensity, sprints, hill climbs, whatever makes you feel like your lungs are staging a protest. This combination builds endurance, strengthens your heart, and doesn't overstress a system that might already be dealing with hidden issues. Here's the analogy. Zone 2 training is like regular highway driving. Steady, efficient, builds up your engine's stamina over time. High-intensity training is like flooring it on an empty road. Fun, exhilarating, great for testing your limits. But if you do it all the time, especially if your engine already has some wear and tear you can't see, you're asking for a breakdown. The 80-20 split gives you the benefits of both without turning exercise into Russian roulette. Let's address the big objection head-on. This is just fear-mongering. Healthy people don't need to worry about this. Except they do. Because healthy is subjective. You feel healthy. You look healthy from the outside, but your arteries don't care about your gym selfies or your meal prep Sundays. Genetics matter. Inflammation matters. Stress matters. Sleep matters. And sometimes, despite doing everything right, your body is still building up plaque because that's what bodies do when they're dealing with modern life. Sitting for hours, chronic stress, processed foods, air pollution, and a pace of life that never actually stops. You're not invincible just because you can run a 5K without stopping. You're just someone who exercises regularly and also might have plaque building up. Both things can be true at the same time. Another objection. These tests are expensive and unnecessary. A coronary calcium score costs between $75 and $150 out of pocket. A heart attack? The average cost is somewhere between $20,000 and $100,000, depending on how bad it is. That's not even counting the cost to your quality of life, the fear, the recovery time, the medications, the lifestyle changes you'll be forced into instead of choosing proactively. One test every 5 to 10 years is not expensive. It's insurance. Here's what happens if your calcium score comes back elevated. Your doctor will probably recommend a CT angiogram. That one does use contrast dye, and it's more expensive, usually a few $100 to $1,000 depending on your insurance. But it gives you a detailed map of your arteries, where the blockages are, how severe they are, whether you need medication, lifestyle changes, or if it's serious enough, a stent or surgery. And here's the thing nobody tells you. Catching this early means you have options. You can treat it before it's an emergency. You're not in the back of an ambulance hoping you make it to the hospital in time. You're sitting in a doctor's office having a calm, rational conversation about next steps. This matters to you because we've all been sold a lie. The lie is that if you eat right and exercise, you're protected. That heart attacks only happen to people who live on cheeseburgers and never move from their couch. And sure, those things increase your risk. But they're not the whole story. You can do everything right and still have a genetic predisposition to plaque buildup. You can run marathons and still have inflammation your body's been quietly managing for years. The system we've been taught, annual physical, cholesterol check, blood pressure reading, gold star, see you next year, was never designed to catch this. To recap, half of heart attack victims have normal cholesterol, so your clean blood work doesn't mean your arteries are actually clean. A coronary calcium score is a 15-minute test that shows you plaque buildup happening right now, not just risk factors that might predict problems someday. If you're over 40 with family history, or over 50 regardless, ask your doctor for this test. It costs about $100 and could save your life. 80% of your cardio should be Zone 2 training, conversational pace, heart rate around 180 minus your age, and 20% can be high intensity. And the biggest point of all, being fit and having healthy arteries are not the same thing. And pretending they are is how healthy people end up having heart attacks nobody saw coming. So here's the real question. If a $100 test could tell you whether a heart attack is quietly building inside you right now, what's actually stopping you from getting it?